So my topic tonight is challenges and opportunities in training, in medical training in Africa. And I'm Dr. Katumba, Ssentongo, Gubala, the Registrar, Uganda Medical and Dental Council. As you know, medical and dental councils worldwide, they play a regulatory role in training of medical and dental students all over the world, and this is normally in their acts. They do a lot of things, but for the purpose of this meeting, this is one of the roles actually they play, and we do it together with some agencies. And as you know, in Uganda or in East Africa, there are councils for higher education where we work together. And there under, we do the following. The councils, together with the National Councils of Higher Education, we review and pass the curricula of medical and dental courses before they are taught. We do the preliminary inspection and approve of training sites together with other agents. We do routine inspection of training sites. We provide feedback to the training institutions, and we are also in charge of interns training. So, what are the challenges that we have seen in the process of our work? For those who are coming outside East African region, East African community, we have joint regulatory bodies where we work together, especially in education. So as I speak here, I also speak for my colleagues who are in East African region. Kwa hiyo wa Kenya, karibu sana. So the first one, this has been talked about, poor selection of candidates because there's no career guidance for the students and even the parents. So you have found that sometimes the right candidates are missed. The system we have does not promote equity. There is a 5 miles, not kilometer syndrome. You find the children who are born around Kampala, they are the same ones who are going to go to schools and eventually in the university. But they might not be the necessarily the people who should be doctors. So you miss out on some good brains, as talked, people from outside. As you see, all the professors who are here, they are not born in Kampala, and if it continues like this, we would have missed all of them. 2, inadequate human resource. This is a very big problem in the East African region, especially in basic sciences. I'm aware that Mesau is doing some training, but still we have a very, very big problem. If people don't appreciate basic sciences, then there will be serious gaps in clinical disciplines. We have been talking to the clinical lecturers, and they are saying they are sometimes having difficulties to panel beat people who didn't appreciate basic sciences very well. So it's a very big gap there in basic sciences because many people have not taken on basic sciences, despite some funding which we have. Inadequate learning facilities. In East Africa, to start a school, the East African community has put a basic minimum which you have. And that one goes with what we think should be the number of students you train. But some universities have not managed to get funding, and then unfortunately we found that they want to increase the numbers when actually the infrastructure is not expanding at the same rate. So inadequate learning facilities, you are talking about space, you are talking about what are they? Skill labs, you are talking about cadaver places, you are talking about so many other places, laboratories. You found they are inadequate in our region. The big one, we are having a problem with inadequate supervision of especially clinical students. Those of you who read Monitor New Vision 2 weeks ago, where some clinical students from one of the universities are complaining about a lack of guidance and they are not well supervised. I saw a presentation from Kenya which is saying, if you want to learn, get those first. Yeah, I saw a presentation which is going to come. If you want to know the road, get to those and you learn better. But in Swahili, somebody can say, unaweza kapotea kabisa. You might get lost completely. You might get lost completely if you don't have guidance. I want to inform you that for the clinical disciplines, they attract a lot of legal and ethical issues. And the councils are very keen to see the supervisors of the students who are not doing so. So this is a very big gap, which as we are trained, we need to be careful about. First of all, it is unethical not to supervise adequately your clinical students. But of course, it will attract a lot of legal and ethical issues to you, the supervisor, and of course, it damages the name of the institution. Another challenge we have, of course, is the brain drain. And other people talk about drain of brain. We are losing a lot of people who are going outside, and this one is affecting actually the training cadres. We are losing a lot of people. Within, there are some people who are doing other things inside the country, but other people have moved to other countries where the universities are a bit better. So this is a challenge to training in our region. Inadequate approach to technology. Yes, the universities have embraced technology, but I think we can do much. We can do much more in terms of e-learning, e-labs, and how we can utilize them, as I'm going to talk about the opportunities. There is a big talk about role models. Those former old doctors, where everybody was admiring their competence, that they are no longer there. And the young doctors, actually, they are not having very good role models to guide them on who a professional should actually be. Lastly, on the challenges, of course, you have competition from other schools because human resource is scarce, as you have seen, and some countries, actually outside, developed countries, have decided to depend on developing countries to train, and for them, they just poach. But to produce a good product which is competitive on the market, you need to do a lot of input there. So we need to get good products which can compete, because you are not training doctors for Uganda or East African region, you are training at the international level. So the competition should be an indicator that we need to have good quality products on the market. There have been some, in East African region, allegations of exam leakage. I hope there are no journalists here. Because our profession is one of, when somebody steals some other thing, people will not be so worried. But if somebody steals exams and is a doctor, it can really be very dangerous. So allegations of examination leakages which didn't, our outputs, of course, once people know that your university exams leak, your products actually will be heavily dented, and your growth will be threatened as a university, because private university, even the public universities, we still depend on private students. No parent is going to send a child to university which has been dented. So, what are the opportunities we have? These have been elaborated, but I can say we can do careful selections of candidates without making people in town unfortunate, but we can promote equity so that we can also get brains outside. Maybe you could actually get even better doctors than what we have. Are you talking about aptitude tests? Is it possible? How can it be void of corruption and leakages, as we have had? Two, can we share the resources we have? We're talking about basic sciences. Can we do block teaching so that maybe somebody who is teaching anatomy in KIU can come to Guru and he has a block? Because at the moment you find somebody is teaching the forearm, then he's not there the next week, he's in another place. How do you continue like that? So do we have opportunities for resources like telemedicine, that somebody can lecture to 4 schools at once where it is appropriate? 3, e-training. E-training, I've seen KSMC here, they are having very good approaches. But even in Uganda we have. We went to Somaliland, a new country which is starting, and we found they had a library like this. And it was an e-library. and I thought it was a very good idea. You have computers, everything is there. So you don't need these books and the librarians to check who is stealing books and all those dust and whatever. The thing is there. It is new, it is convenient for the students. So I think this one we can invest much more there in e-training because there are a lot of opportunities which can accrue. Of course, opportunities, we have the East African protocols. When a local council accredits your university first, the East African community also endorses you. If they don't, then it means your students will go to do exams in Kenya or Tanzania or Burundi. So it is helping us. So we want to enhance on this to make sure that the East African community can enforce, because sometimes the local councils can be muzzled by the local politics. But the East African community can never. If they say, we have refused, like 2 years ago they refused the university in Tanzania which was starting, which was not up to the standard. We said we are not going to recognize it unless you put 1, 2, 3. So we want to enhance efforts of these authorities so that we can move together. Somebody talked about self-assessment at the institutional level. Can we assess ourselves to see what we are doing inside ourselves, even without the regulators coming? Of course, curriculum reviews to be in line with the time, because so many things are changing. We need to really be dynamic to see what is appropriate and what is not. Then inter-university visitations, not by the councils, but among ourselves, our universities. If there's something to learn, because you don't have a lot of resources to do research, if something works somewhere, it is appropriate, copy and apply. And we go ahead. That's the best way you can use the resources. I conclude that we still have challenges, but we also have opportunities which we can utilize. And people who have come up with innovations that have been useful, and we can bring them on board. Asante sana.